Okay, letting everyone in now.
Good afternoon et bon après-midi à tous. Thank you for joining us for today's special media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, a few friendly reminders. Please put your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery, and that button is located in the top right corner of your screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez aussi changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant besoin en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health at Ottawa Public Health, and Dr. Jennifer Lemesurier, Family Physician and Public Health Resident at Ottawa Public Health. Nos porte-paroles aujourd'hui sont la Dr. Vera Etches, médecin-chef en santé publique, et la Dr. Jennifer Lemesurier, médecin de famille et résidente en santé publique de Santé publique Ottawa. Je passe donc maintenant la parole au médecin-chef en santé publique. Please go ahead, Dr. Etches.
Thank you, merci, bonjour. There are many more people testing positive for COVID-19 in Ottawa. This is concerning for our community, for public health, and for me. Over the last few weeks, this alarming increase in COVID, I want to say that I have heard from many of you that you want to know where the transmission is coming from. And so today we are sharing more information to try to empower each and every one of us to shift our behaviors and to make choices that keep our close contacts as low as possible. Aujourd'hui, nous partageons de l'information que nous espérons responsabilisera chacun d'entre nous à changer nos comportements et prendre les décisions qui minimisent les contacts étroits. So I want to thank the vast majority of people who are limiting their close contacts. And for others, let me be clear that I mean we need to keep our close contacts to the people that we live with one or two people who support us, or we risk closure of businesses and schools. Je veux être clair. Ce que j'entends par ça, c'est que nous devons limiter nos contacts étroits aux personnes avec lesquelles nous vivons et une ou deux personnes qui nous soutiennent. Sinon, nous risquons la refermeture des entreprises et des écoles. So when people are testing positive at the rate we're seeing, the disruption to society and the pressure on our hospitals and our long-term care homes is too much to sustain critical services. Earlier this week, Ottawa Public Health, in collaboration with our partners at the Ottawa Neighborhood Study, released data that shows the prevalence of COVID-19 by neighborhood. But while this data helps us identify areas that might need more support, it only reflects where individuals testing positive live and not where transmission is occurring. The majority of transmission is still occurring between close contacts in private social gatherings. However, more recent data is revealing examples of exposures in other settings. La majorité de transmission a toujours lieu entre des contacts étroits lors de rassemblements privés. Par contre, des données plus récentes révèlent des exemples d'exposition dans d'autres contextes. So today I've invited my colleague, Dr. Jennifer Lemesurier, a medical resident with us at Ottawa Public Health, to discuss different exposure sites in Ottawa. Jennifer, over to you.
Thanks very much, Dr. Etches. Pleasure to be here with you today. So what I'll be talking about is where residents of Ottawa may be exposed to the COVID-19 virus. And Ottawa Public Health follows up with every resident who tests positive for the COVID-19 virus and asks them who they've been in contact with. When a person tests positive for the virus, our team asks questions about where they've been in the days leading up to developing symptoms, being tested, and self-isolating, so we can try and identify where they may have come in contact with or been exposed to the virus. People who test positive often list many different types of situations and locations where they may have come in contact with the virus. So sometimes it's not possible to pinpoint the exact location where the virus was transmitted from one person to another. Les personnes dont le test est positif mentionnent beaucoup de différentes situations et endroits où elles peuvent avoir été en contact avec le virus. Il n'est donc parfois pas possible de déterminer la situation exacte où le virus a été transmis d'une personne à une autre. Each and every one of us has an important role to play in preventing transmission in the Ottawa region in both private and public settings. Transmission is occurring through people connected by social interactions in complex networks across the city. Looking across the data we've collected from residents of Ottawa who've tested positive for the virus in the first 2 weeks of September, what we found is that 1 in 2 people who test positive have been exposed to the virus through their household. Une personne sur 2 dont le test est positif a été exposée au virus dans son ménage. It's important to note that the first person with COVID-19 in the household obtained it while in the community. 1 in 4 people who test positive are exposed to the virus from members outside of their household through social interactions in indoor and outdoor settings. Une personne sur 4 dont le test est positif a été exposée au virus par une personne à l'extérieur de leur ménage lors d'interactions sociales à l'extérieur ou à l'extérieur. This is a major driver of transmission in Ottawa and is happening at social gatherings in places like homes, backyards, cottages, short stay apartments, hotels, restaurants, and bars, during events with family and friends like birthday parties, weddings, and housewarmings. We are seeing these gatherings within the Ottawa region, but also we're learning about settings where people have been exposed by travel to Quebec and elsewhere in Canada. In people who test positive over 40 years of age, 1 in 3 people are exposed to the virus from an outbreak, in particular through an institutional setting like a long-term care or retirement home. This underscores how the level of transmission in our community affects people at highest risk of serious illness and death from the virus. While the virus that causes COVID-19 is present in every neighborhood across Ottawa, we are also seeing that about 1 in 10 people who test positive without an identified close contact may be exposed to the virus in areas where we are seeing neighborhood clusters. That being said, because this is based on where people live, it does not necessarily mean that this is where people have caught or acquired the virus. Exposure occurs where people congregate, and that includes workplaces and other public areas. When we look overall at the early impact of school reopening and daycare attendance, we're seeing that about 3% of people who test positive are linked to an outbreak in a school setting, but that 9% of people identify school as a possible exposure. We're seeing about 3% of people who test positive identify daycare as a possible exposure. We've recognized the strain that school and daycare closures are having on families. And as a fellow parent, I want to thank parents and caregivers for everything they're doing and trying to protect our children and our community. So before I hand things back to Dr. Etche, environnement intérieur et extérieur, lieu de travail, garderie, voyage, foyer de soins de longue durée, et entreprise. Someone can bring it from the home to these settings and vice versa, and the social gatherings that we're having outside our household are leading to transmission in our long-term care homes and schools. As more people test positive for COVID-19, there are more close contacts our case management team has to reach out to. The best way to protect ourselves and our loved ones is by being COVID-wise. La meilleure façon de protéger ses proches et soi-même, c'est en étant COVID avisé. The transmission of COVID-19 continues to occur at a concerning rate throughout our community. We can all have an impact on bending the curve by reducing the extent of our social interactions beyond our household as much as possible, whether in private, dedicated to transparency, and will continue to use the data we collect to tell the story of how the virus is traveling throughout our community. Thank you. Merci.
Thank you, Jennifer. So we can see transmission occurs through people connected by social interactions and in a variety of settings within a home, at school, within a long-term care setting, at a wedding, a restaurant, a bar, even outdoors. And so exposure to COVID-19 can occur anywhere where people congregate. And what ties it all together is not necessarily the setting itself, but it's about the behavior. So the best way to limit your exposure to COVID-19 is to practice physical distancing, to limit your close contacts to those within your household, one or two essential supports like childcare providers or grandparents. And additional layers of protection include wearing a mask, staying home when sick, and washing your hands regularly. These are the basics that we all need to follow. And it is imperative that we get back to basics to flatten the curve once again, especially as we approach the winter months. Nobody wants to take a step backwards. No one wants to go back to stage 2. Il est impératif que l'on revienne à l'essentiel pour aplatir à nouveau la courbe, surtout à l'approche des mois d'hiver. Personne ne veut pas je m'excuse. Personne ne veut un pas de recul. Personne ne veut revenir à l'étape 2. So right now, most of the people who test positive for COVID-19 are in younger age groups, so our hospitalizations are remaining relatively stable. But the more COVID-19 transmission occurs in the community, the more difficult it will be to protect people who are more vulnerable. In fact, right now, our hospitals do not have room to handle many COVID-related hospitalizations. Our long-term care homes are stretched already. So no one should ever think that their individual actions don't matter. It takes just one person going out in public while sick to infect dozens of others and hundreds of people needing to self-isolate. Personne ne devrait penser que leurs actions individuelles n'ont pas d'importance. Il suffit d'une personne qui sort en public pendant qu'elle est malade pour infecter des dizaines d'autres et des centaines de personnes qui doivent s'isoler. So I'm asking you, our media partners, to help spread this message. The media relations team will share this graphic that Dr. Mise showed you so you can help paint a better picture of where exposure and transmission of COVID-19 is happening in the community. We all want to keep sharing this information in different ways so that people get the main message and they can grasp what we're dealing with about changing our behaviors to limit our contacts to people of our household plus one or two social supports. Thank you, merci, and miigwech.
Thank you, Dr. Etches. Thank you, Dr. Lemessurier. I will now invite each agency in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. Je tiens aussi à souligner aux médias francophones que la docteure Lemessurier ne peut répondre aux questions en français. Veuillez s'il vous plaît lui poser vos questions en anglais ou vous adresser à la docteure Etches. Nous pouvons également vous transmettre une déclaration en français par courriel au besoin. We'll now start with 1310 News. I think we have Alex Gouge. Please go ahead.
Yes. Hello. So Dr. Etches, if we continue with this trajectory, where do you think the daily case count in Ottawa will be in mid-October?
Dr. Etches, you're still on mute, unfortunately.
Yes, thank you. Well, the trajectory is following a path where cases are doubling every 10 days or so. So you could see us going up above 200 within that time period. You know, we don't want to go there. It doesn't have to be. It really is up to us, and we've done it before. You know, the people of Ottawa know what to do. So I'm hoping our actions today would actually show some progress by mid-October. That's enough time to see that limiting our contacts right now can start to slow things down.
And you said limiting to your household and a couple essential contacts. Just for clarification, what are those essential contacts? I
expand a little bit beyond the household, the people you live with, because we know we heard many stories of social isolation that was harmful in the first wave. So families where it's a single person or a single parent, need more supports, whether it's from another family that provides childcare, or a friend, or a neighbor, or somebody who supports you with mental health needs. The idea is that it's just very few beyond your household.
Thank you so much.
Thank you. Our next question will be from CBC. Stu Mills, please go ahead.
Hi, good afternoon, Dr. Etches. I wondered if you could tell me whether it's likely that Ottawa could go back to something like a stage 2 scenario or a hybrid of a 2-3 type scenario, even if the Premier continues to feel and to say that isn't the direction that he wants to go in. Is it something you could do independently, or that you're considering doing independently, namely rolling back spas or gyms or banquet halls or places of worship, those kinds of restrictions?
The response to the pandemic has been a partnership. It's involved much partnership all around, but between the province and the local level, where we have a good understanding of what's happening in our communities as local medical officers of health, and we share that information with the provincial level, and we talk about what might be needed to address what we're seeing in our communities. And so, I think this is a way we want to continue to work with the province. We also know the provincial regulations are the most effective tool we have to be able to make it clearer to people, what needs to happen to limit our social, connections. And so, we would be looking to the province to be able to use provincial regulation if we need to use that tool, if we're not seeing enough movement in limiting connections between people. Does that answer your question? And I think that that regulation framework is what we've been using to be able to access, for example, the bylaw support for enforcement, and it helps with communications across the province to have some shared framework for the restrictions.
Yeah, no, I think that does answer the question. Perhaps just to capitalize on my follow-up, I'll ask whether you're concerned in particular about the looming date of Thanksgiving in a couple of weeks, and whether families will be trying to get together or skirt around the rules in the way they did at different times in the summer and break their bubble or make double bubbles or these kinds of things. What's your message for families who are looking forward to seeing kids who are away at school or this kind of thing?
It's important to celebrate Thanksgiving, and the way we need to celebrate it this year is with people we live with, plus that one or two other, that maybe social supports. So it really does mean that I'm recommending against, traveling, adding to your household beyond that.
Thank you. Thank you. Our next question will be from CTV Ottawa. Josh Pringle, please go ahead.
Thank you very much. During the presentation, you said that 1 in 4 people through the first 2 weeks of September contracted COVID-19 through social interactions. Do you have any idea how many have been contracted through restaurants, bars, movie theaters, gyms? Because when people see the case count every day of 50, 100, the first thing to do is jump to let's shut down bars and restaurants. Any idea how many of these cases actually are coming out of restaurants, or is it just they're coming from social connections with people?
Thanks, that's a great question. So that 1 in 4 people who we know are exposed outside of the household have a big, it's really about the exposure. So they've identified that these are places that they've been in the days preceding their diagnosis. So before they got diagnosed, these are the places they've been. And what we're noticing is that in some cases, we're seeing people have been lots of different places where they have been at risk of exposure to the virus. And there are like more detailed analyses about specific numbers, but it's really hard, as I said, to pinpoint down the exact moment of transmission. But what I can confirm is that we have seen transmissions in those settings. It's not simply about the matter of exposure, and so that's what we're able to do in terms of our analysis.
And my follow-up question, Dr. Etches, with you saying that perhaps we could get to 200 cases a day by mid-October unless the current trajectory changes, are there things that you're thinking of doing to enact rules, fines to limit people's social gatherings, or do you have to wait for the province to do that?
You know, it's never going to be rules and regulations that get us out of, you know, a COVID situation that's not so manageable. It's going to be people caring for each other, doing the right thing. You know, what I know is that it is hard to regulate, you know, the number of people that gather together outside of a household. You could imagine it may be worth looking at some settings where that kind of close contact happens, and thinking about, you know, limiting the exposures in those settings in different ways. But I think, you know, the message is that it actually is about us just remembering that if we distance and we wear a mask indoors, we're very unlikely to be exposed to the virus.
Thank you. Our next question will be from Global News. Global News, I think we have Craig Lord on the line. Please go ahead.
Thanks very much. I just want to dig into a little bit the restaurant sort of question as well. I think there's a conception that restaurants are these scary spaces where if you go in, you know, the virus could get you from any angle, that kind of thing. But based on kind of how I was interpreting maybe your comments, Dr. Etches, it seems that when you're meeting people and having social interactions, it's those people that you're meeting with are actually the source of transmission. Is that more accurate? Can you just maybe, I guess, spell out what does transmission look like when it's happening in these restaurants and the sources that people are actually getting the infection as far as we can tell?
So I can talk a little bit more about what we've seen in those types of situations. And what I can say, where we have seen evidence of transmission in restaurants or bars, it is about the situations that you described, where it's meeting socially with close contact. And typically, it's been from close interaction between staff members, for example, in more of a workplace type setting, or in transmission between patrons or persons who are attending events in a restaurant. So, but not where we've seen transmission, from example, from a staff member at a restaurant to a patron of the restaurant. But that's the type of transmission that we're seeing there. It's really about that close interaction between individuals outside the household where we've seen it.
Great. And just another question sort of around businesses like restaurants and gyms. Is there a worry from public health's perspective about creating sort of a stigma around these sites? You know, on one hand, balancing not wanting to scare people away from businesses to keep them, you know, the doors open and keep the economy flowing versus, you know, getting them to practice the safest medical advice to reduce the chance of transmission. So are there concerns about the branding of restaurants and these kinds of businesses as places of transmission?
I can take this one. It is the case that businesses are working really hard to make their operations as safe as possible, and I think they should get credit for that. You know, there are many different ways now people are working, wearing masks, making distancing possible, a lot of other things you see people are implementing, you know, making hand sanitizer available, and so we do want to emphasize that with those kinds of things in place, it makes the environment safer. And in contrast, we don't take that kind of precaution ourselves with our friends and our family and our close connections, which does make our private gatherings, potentially more of a risk for transmission of COVID. So I certainly am of the opinion that we need to keep as many businesses open as possible. And I guess, what I'm suggesting is gather just with your household. If you're going to go out to a restaurant or a bar, keep it to those contacts. That's the way to try to limit transmission of COVID.
Thanks very much.
Merci. La prochaine question sera de le droit. Julien Paquette, c'est à vous.
Oui, bonjour, Dr. Etches. Vous avez mentionné plus tôt que la capacité dans les hôpitaux commence à être de plus en plus limitée. Est-ce que vous avez de l'information concernant il y a une information qui a circulé hier à l'effet qu'un hôpital d'Ottawa a dû annuler ou reporter des chirurgies à cause du nombre de patients de COVID présents dans leur établissement. Qu'est-ce que vous pouvez me dire là-dessus?
Oui, je n'ai pas les détails exacts pour la capacité dans les différents hôpitaux, mais j'ai des réunions avec les présidents des hôpitaux et c'est clair qu'ils sont vraiment occupés. Non, les RFS sont occupés et c'est aussi c'est un système vraiment où une partie a un impact sur l'autre. Alors, c'est aussi les situations dans les foyers de soins de longue durée où le nombre est diminué. Alors, il y a plus de gens dans les hôpitaux qui a besoin d'un lit dans un foyer de soins de longue durée, mais il n'existe pas une option pour eux. Alors, ça, c'est un problème avec la pression pour les hôpitaux maintenant. Aussi, les hôpitaux, la tâche de recommencer avec les chirurgies et c'est important d'avoir les employés pour ça. Et quand il y a une éclosion ou besoin d'aider les foyers de soins de longue durée, le nombre de personnel aussi est un défi. Alors, ça c'est la situation maintenant, sans plus de cas de COVID-19.
Parfait. Et mon autre question, ce serait concernant, il y a une élection partielle qui a été déclenchée. On a pris la décision de la déclencher cet été alors que la transmission semblait sous contrôle. De la façon que les choses évoluent, est-ce que vous croyez qu'il y a un risque pour le jour du vote lundi prochain?
Je m'excuse, le risque de quoi lundi prochain?
Il y a l'élection partielle dans Cumberland lundi. Et le fait que des bureaux de vote vont être ouverts, que plusieurs personnes devraient, on l'espère, se rendre pour voter. Est-ce qu'il y a un risque? Comment vous cette situation-là? Est-ce qu'il est possible que vous recommandiez qu'on reporte l'élection? Ou...
OK, non, je comprends la question maintenant. C'est concernant le risque de l'élection. Nous avons travaillé beaucoup avec la ville de créer des mesures pour protéger les gens qui vont voter et aussi les travailleurs dans le sens où on va voter. Alors ça, c'est correct, c'est important d'avoir l'opportunité de choisir nos leaders et nous avons changé la pratique d'avoir distanciation physique aussi, l'utilisation des masques. Les mesures comme ça fonctionnent de diminuer le risque de transmission de COVID-19.
Merci beaucoup.
Merci. The next question will be from the Ottawa Citizen. Taylor Blewett, please go ahead.
Hi, so my first question, I was really hoping, Dr. Etches, you could just clarify, when you talk about close contact and keeping it to members of your household and those one or two other support people if necessary, what really, like, I think I know the answer to this, but what does close contact actually look like? And what is still safe for people to do with those outside of that household or close contact group? You know, can you go inside someone's house with a mask on? Can you go out, you know, for dinner to a restaurant with someone who isn't part of that? Like, can you do anything? Because I know this kind of messaging, it was different at the beginning than, you know, it might be now.
Yes, thank you for that question. I think it's important to clarify. We recognize the importance of social connections, and so, you know, when I say close contact, it's you're within 2 meters of somebody, and you're not taking the protection, you know, precaution of wearing a mask. And close contact, you know, you're also in a household, you know, you're sharing a washroom, you're eating meals together, you might be in the same sleeping area. So, you know, that's a kind of close contact where that's, well, we see it leads to COVID transmission. You know, Dr. Mise showed that's a major source of transmission. So in contrast, when you meet with others outside of your household, you should do that with 2 meters of distance and a mask if you're indoors. So if somebody's going to visit, it's always better to reduce the risk by visiting outdoors with the distance. If people come inside, to do it with distance, with masks on. That will reduce transmission. I am advising that you don't go out to a restaurant with members outside of your household if you're going to eat and drink, which is generally what you do in restaurants, because that becomes close contact. Then you're sitting within 2 meters without a mask on. And so, you know, that is a change. I'm asking people to be more careful right now, that we can't manage the level of COVID in our community continuing to grow. And so this is really a strong message. It's about back to your household plus 1 or 2 supports.
Thanks so much. And I wanted to ask as well, in the time since the Section 22 class order was published, can you give me a sense for how much you've actually had to use that in kind of individual situations, and what those situations have been in a very general way?
We haven't had to use it at all. To my knowledge, nobody's been asked to appear in court or you know, no one's had to proceed to that stage.
Thanks so much.
Thank you. The next question will be from the Ottawa Sun. We have Joanne Lossius, I believe, on the line. Please go ahead.
Hi, can you hear me?
We sure can.
Okay, I was wondering if we could go through those transmissions that have been linked to schools numbers again, and maybe if you can give me a bit of interpretation, because the proportion actually seems quite low to me.
Yeah, it is about the proportion of where we're seeing the cases, and what we're showing when we're looking at school reopening in particular, remembering that this is only a snapshot of a 2-week, the first 2-week period in September, and it doesn't tell us like what's happening right now in this moment, and when we look at schools, what we're seeing is it's more about the transmission outside of the school, and then having a case that then happens in a school setting. So it's less about transmission within the school population, but it's a little bit too early to talk too much about that with using this type of analysis and this data. And what's most important is that in this, you know, in what we're trying to describe is that the actions outside of the school are what are impacting on schools and school closures and cohorts of children having to be sent home as a result of a person testing positive. And that's what's most important to convey as part of this message.
For the follow-up question, is there at what level or what proportion of transmissions within schools will you have to take some sort of action or broader action in terms of schools?
I'm not sure there's going to be a set number or a threshold. We're all learning about what the school situation, is going to evolve into. Dr. Lemesurier is right that we've seen a lot more introduction of the virus into schools than we've seen a spread within the schools. Certainly one of my goals for the pandemic response is to keep schools open. So I won't close them down easily. And it needs to be something that is I think it's a community discussion, and we need engagement on it before taking such a drastic action to close schools. We need to have input from parents, from teachers, school boards, employers. We know anytime the schools are closed or children have to stay home from school, that has an impact on people's ability to work. And so there's no specific threshold or answer. We're learning. We're going to try to keep the schools open, and I think so far that's been possible.
Thank you.
Thank you. Nous passons finalement à Radio-Canada. Frédéric Pépin, c'est à vous.
Oui, merci. Alors, la question pour vous, Mme Mise, vous nous avez donné des statistiques là, pour les 2 premières semaines de septembre. C'est intéressant, là. 1 sur 2 avec des personnes dans notre même résidence, 1 sur 4 avec des personnes à l'extérieur. Qu'est-ce que ça veut dire, ça? Parce que, dans le fond, ce que vous dites, c'est 50% des personnes attrapent la COVID parce qu'il y a quelqu'un qui l'a chez eux et un quart des personnes l'attrapent à l'extérieur. Qu'est-ce qu'on doit retenir de ces chiffres-là? Qu'est-ce qu'on doit dire à la population? Parce qu'il semble que même rester chez eux, ça ne ferait pas vraiment une différence, puisque le virus peut quand même arriver chez nous.
Oui, c'est clair que c'est un risque. Alors, nous avons 2 différentes approches. Une, c'est de partager l'information avec les gens qui ont un dépistage positif pour COVID-19. Comment on peut isoler dans leur foyer. Et nous avons des instructions, nous avons des soutiens, on peut avoir aide avec différents aspects, mais c'est plus facile quand il y a une grande maison, c'est plus difficile avec un petit appartement. Alors, l'autre action qu'on fait maintenant, c'est avancer le processus de créer une sorte d'isolation pour les gens qui ont un dépistage positif, qui veut, c'est volontaire, qui veut isoler dans un lieu dehors de la maison. Alors ça, c'est un plan en avance maintenant.
Bon, alors, Mme Mise, vous voyez, Dr. Mise, vous voyez là, qu'au Québec, on commence à resserrer. On s'attend à ce que l'Outaouais passe dans la zone rouge. Là. Ça serait la zone la plus grave là, du côté du Québec pour ce qui est des restrictions et des mesures préventives. Est-ce que du côté d'Ottawa, on est en train d'envisager de passer, évidemment, le système de couleurs que vous avez émis est différent, là, mais on sait qu'on est dans une zone qui est orange à Ottawa présentement. Est-ce qu'on est à la veille de passer à la prochaine zone rouge ou ça demeure quand même stable avec les hospitalisations qui sont limitées?
Oui, c'est les hospitalisations que je continue de utilise pour déterminer quand c'est important d'aller à la prochaine étape à rouge. Et maintenant, il y a juste une petite augmentation dans des nombres de personnes hospitalisées. Mais comme j'ai mentionné, je pense aussi en français, les hôpitaux sont déjà vraiment presque à la limite pour leur opération.
Merci. Alors, ceci conclut le point de presse aujourd'hui. This is all the time we have today. Thank you very much, media partners, for all of your time. And we will have sent by email the infographic that was presented today. Merci à tous.